Today, the NAMI, with its component activity, the Naval Aerospace Medical Research Laboratory, is a multi-million-dollar 18-building complex devoted to training, consultative support, and research in all phases of aviation and space medicine.
Stand by, rotate.
We're now traveling at 10 RPM, and we're going to dim the lights. I would like you to direct your attention to the target on the far wall. I want you now to make a head movement. On signal, please move your head from the upright to your right shoulder rather briskly. Ready? 1, 2, 3.
In a Coriolis acceleration platform,
As you see,
he will feel some of the strange effects of centrifugal force, and he will have an opportunity to experience the Coriolis effect, a sensory phenomena which may play a contributing role in many aircraft accidents.
Hypoxia Demonstration. Seats 6 and 7 turn and face one another, disconnect from your oxygen supply, and commence your patty cake routine. If the rest of you in the chamber will observe some of the symptoms of hypoxia that we went over in the classroom. Take particular notice of cyanosis, or loss of natural coloration around the hands and the forehead, and of course the loss of muscular coordination. Seats 6 and 7 plug back into your oxygen supply, switch to 100% setting on the regulator, sit back and relax. The rest of you will observe how rapid the recovery is with 100% oxygen. When you feel back to normal, gentlemen, please give me a thumbs up. Roger.
At an atmospheric level of 35,000 feet, the doctor will begin to appreciate the stresses of gas expansion when flying on a full stomach.
Its size has increased fourfold from its normal sea level volume.
In a high-altitude chamber where a man can be taken up to 70,000 feet, the physician will begin to comprehend the difficulties of man's entrance into outer space.
Inside the suit at this altitude, of course, every fluid in your body, including the bloodstream, would be boiling away due to the fantastic drop in barometric pressure. Okay, move around, test the mobility of the suit. See if you can get to that face curtain. Okay, how about the alternate firing handle between your legs? Could you get to that? Okay, tell me what it feels like in there. Do you think you could fly a plane?
I think so, but it'd be quite hard because of the bulkiness of the suit.
Okay, real fine. As you can see, this affords you protection at 70,000 feet. That's what it's designed to do. You wouldn't want to fly a mission at this altitude under these circumstances.
In the classroom, the flight surgeon will gain a thorough insight into the common afflictions of the ear, nose, and throat, with special attention to those problems which might affect the aviator. Here the doctor will learn that such problems as the earache that affected Lieutenant McIntosh are caused by the absorption of oxygen after high-altitude flying while breathing 100% oxygen. Such a condition is not dangerous, though the aviator must be grounded until the aerotitis is cleared. In cardiology, the flight surgeon will receive a comprehensive review of the electrocardiogram. He will learn to recognize that the tachycardia and faintness experienced by Lieutenant J.G. Matthews were caused by the Wolff-Parkinson-White syndrome, and that such a condition is dangerous to the performance of a pilot whenever he is in the air. For his own safety, such an individual must be permanently grounded. And then in ophthalmology, the physician will gain extensive experience with refraction. He will learn that the visual problems, such as those complained of by Captain Platt, can be caused by small degrees of astigmatism. The physician will learn how to correct for them and what lenses should be prescribed. And then in psychiatry, the flight surgeon will learn about the Cold War, the internal combat which struggles in the minds of all men who work under the constant stress of danger. And he will learn that the complaint of earache or blurry vision or tachycardia are not always due to pure organic problems. For many physicians, the adjustment to military life takes a little time. It means shedding off some of the old clothes for a brand new set of uniforms. It means learning a few of the military traditions like the hand salute. And it means the discovery of an entirely new clinical entity never before encountered. A real live Marine DI.
Head, hut. Rest, right, rest. Right, deep breath. Cover. At ease. Gentlemen, in next movement you are going to learn will be staff about.
Throughout history, the Marines have had a courageous and brilliant career. But certainly one of the most challenging duties they will ever have to perform is the familiarization of a group of physicians on how to march.
At this time, I would like 4 volunteers. You, and you. Staff about march. 1, 2, 3.
Lieutenant Robert King.
By the time the flight surgeon reaches graduation, he will have covered a phenomenal amount of ground. Over the previous 6 months, he will have reviewed almost every aspect of aerospace medicine. But the one real highlight for most physicians, the one thing which really tops the program, is learning how to fly.
Tower 421, turning final, 3 down lot, full stop. Roger 421, clear to land.
During the last 6 weeks of the program, you will be farmed out to one of the training squadrons. Here you become a student aviator. You cram and memorize and study right along with the regulars. In the classroom, you will learn about systems like hydraulics and fuel injection, and you will go through every working detail of the aircraft, from the rear stabilizer right up to the cotter key on the tip of its nose. And in the air, you will practice turns and descents. Spins and barrel rolls. And then you will practice things that you hope will never happen.
Smoke pouring out of the port wing, bailing out 5 miles west of Finger Lake. Mayday, mayday.
Like bailing out. Or being dragged by a parachute through the water.